Okay, so I want you to imagine something with me for a moment, right? You go into work, you're a nurse. You live in Joliet, I hope I'm saying that town right, Illinois. You work for Ascension St. Joseph Medical Center. You go into work, you work in the ER. And you're like, "Okay, I'm going to go in. Things have been rough lately." But today you go in and it's like really rough. And you've told your employer, right? You've told them, "Hey, this is a hot mess. We really need to work on staffing. People are dying and this is not safe because we don't have enough nurses," right? And you go into work still, you're like, I'm gonna show up, I'm gonna do the thing. And there are supposed to be about, you know, nurse, you're supposed to have 4 to maybe 8 patients, right? It's the emergency room. This is what it is. But you go in this day and you find out that you're going to have 13 patients who are coming into the emergency room, which could range from like an ear infection to like, oh wow, this is a level 2 trauma center. So you are like having a stroke and trying to die here. And you say, "Hey, my nursing license is actually on the line if I take this assignment. I've told you for a really long time that this is not ideal." So you say, "I'm not going to accept this assignment because if I accept this assignment, right, then if anything happens to these people, it could come back to you because you were the nurse responsible for them." So you say, "Hey, I'm not going to do this." And then your hospital, instead of being like, "Hey, we hear you. We understand this is a problem," they say, "Here's the middle finger. You have to leave. Goodbye." That is the lovely situation that we are going to be discussing today, to raise awareness of it, to discuss what kind of is going on around it, if in case you're not familiar with what is going on, like what would kind of happen in a situation like this. And yes, welcome. Hello. So that's what we're going to be talking about tonight. If you're like, who even, why are you talking about this? I'm Liz. I'm the nurse practitioner. I have lots of opinions and I'm trying to get people aware of healthcare issues so that we can go out in the world and fix them. We're going to be discussing a law that Illinois is also looking at possibly passing, and we're going to look at like how it's sort of helpful but it's not really. They're trying to be like California and make things so that you have nursing staffing ratios, right? Because, and this isn't because nurses are lazy. People in my comments always like to say nurses just need to suck it up. No, we like to have ratios so that like when you're trying to die, we have time to take care of you, not like play cards or whatever people like to say. So we're going to go over that. We're going to go over the why this matters. We're going to go over kind of what their nursing union is doing about it. We're going to go over all the things as long as my voice is here because I yesterday I got back from vacation and my body hates me. I'm sick. It was very fun. I got to actually hang out with one of you, Jay Michael. He got us into Disneyland World. And so we went there for a day. We hung out. He survived my family. So shout out to you, Jay Michael. And it was like super duper fun. To like actually get to like make you have like internet, like he's part of the panel. If you guys watch my channel, we have on Fridays, we have like panel discussions and people feel like my friends on the internet. But this was cool that like you actually got to meet and it was like, oh, we are friends. Like this works. I love it. So thanks, Jay Michael. That was the bomb. But otherwise, yeah, just vacation with 3-year-olds is just like a lot. And yes, Ad Kempt, thank you so much for becoming a member. I appreciate you. You now have the privilege of joining our private Discord server community. Enjoy. It's fun, where we just can chat and do all sorts of things over there. Opinions, you never know. You didn't hear me rant about them for hours the other day. Everything's fine. We are also joined by Doris Carroll. Hi, all. Retired president of the Illinois Nurses Association here. So that is phenomenal. Wonderful. This is incredibly kind of you to stop by. That is the union that represents this hospital. Gamer Captain Studios has just recently left St. Joe's after 2 weeks ago for a different hospital. Stuff like this is a long time coming. I'm so glad you're bringing attention to it. Well, thank you for being here and listening. And any insight you have, I am so appreciative of. M said, how do ER nurses know the ratios ahead of time? I think they saw when they walked into the ER, you don't have like super set. And if you work in the ER, correct me if I'm wrong. I only ever worked in med surg and then like a step down in peds. So our ratios were a little bit more secure, but in general, ER nurses, I would imagine that you kind of expect I'm going to have between, 4, maybe even less if they're really, really sick, to like 7 or 8, but not 13. 13 is like a ton. But they would have showed up and been like, wow, there's only 4 of us and there's 51 patients here. So that's not quite enough. Nurses remain suspended. Thanks, Doris. So these nurses are suspended. Let's go through the story and we'll go over it. Tiffany Freeman says, that's way too much. My ERs have 4 max. Me as the ED tech have 8 with 2 nurses. Wow, that's very nice. The hospitals I worked at, you definitely had some more. 4 sounds great, right? Because you don't know what your 4 are going to be. But 13, no matter what, even if you have more than that. Yes. So Montana Gal says nothing changes if people don't stand up, unfortunately. Exactly. So today is kind of the unfortunate case of people did stand up, because you're right, nothing's going to change if nothing happens. The hospital actually had a strike a few years ago that we'll talk about. And now we're seeing that even when you stand up, this is how hospitals act. So that's why we're talking about it, to try to get people to realize that you shouldn't, if you stand up for an unsafe situation that is literally killing people, right? This is killing patients because they are not getting the attention that they need. This is only harming you as the public, right? This isn't a good look. And this is happening and hospitals are just not paying attention. So allow us to dive in to the situation. Hold on. There we go. Timestampy. Oh, don't know what happened. So Ascension St. Joseph. Also, thanks everyone for being here. I so appreciate you. Do give the video a like if you like it, because that tells the YouTubes that this is great and all the people should watch it and get just as mad as we are. So Ascension St. Joseph Medical Center suspends 4 Joliet, is that how you say it? Joliet nurses who opposed dangerous staffing shortages. Basically, these nurses went into on Friday, 4 nurses. I believe this was last Friday or the Friday before. So if you're watching this later, that's the end of October 2022. 4 nurses were escorted off the premises for refusing to work under unsafe conditions, which is something we say a lot on this channel, right? Is if you go into work and your assignment is way too many patients, and you're like, this is not going to be safe. There's no way this is going to be safe. Don't accept it, because you are not risking your license which you worked really hard for. Remember, at the end of the day, you can always get a new job. It's really harder to get a nursing license. This is where if something happens to you, right? If you are taking care of all these patients, you go in and say your assignment is normally 4 people and that's safe, or you work in an ICU and it's 1 to 2 and they try to give you 3 or 4, particularly 4. I mean, 3 sounds terrifying too. You're not going to be able to give these people the care that they need. You might make a mistake. Do you think these hospitals are going to be the ones that are backing you up? And they're like, don't worry, we were the ones that gave you too many patients. We will take the fall for you. No. No. So that's why we've said over and over on this channel, we've had other people talk about it. Don't take these assignments. If you have not accepted the assignment, you can show up to work without accepting the assignment. That's when you do the whole handover thing. The nurse from before goes over a report, gives you the assignment, which is when you are now in charge of these humans' lives. If you don't accept it, you're not abandoning them, because hospitals will try to tell you, even if you don't accept the assignment, as soon as you show up, you've accepted it. That's not true. You have to accept the assignment to be responsible for them. So these nurses said, hey, I don't want to accept this assignment because there's 4 of us and there's 51 patients and we're a level 2 trauma center, and that's not going to go well. And that's important because even in smaller hospitals, it's the case where you don't know what's going to walk in, but especially at a level 2 trauma center, you're going to be having strokes, all sorts of other things that are coming to you that are could be very life-threatening in terms of what level 1, level 2, whatever. Level 1 is the most hardcore. They always have all the surgeons. They can handle anything pretty much that walks in the door. Level 2 is one step down from that though, and they handle a lot. So you don't want to be the one showing up and being like, hi, grandma thinks she's having a stroke. And you're like, oh, well, the nurse has 5 other patients who are also having strokes. So good luck with that. You know what I mean? So that's why this is important and we care about it. Let me see. So that's where we are. Came in. They normally have they explained that they were willing to clock in. So they're not saying I'm not coming to work, right? They are saying I'm going to be here, and that they were willing to work, but they just had to give them more staffing, which usually means 12 to 14 nurses per shift in the emergency room. Remember, there's 4 of them. And that night, only 4 were assigned. So it wasn't even that only 4 showed up. 4 were assigned. So this is something that the hospital knew the day before. I believe Deb was saying, I might have even just totally gotten your name wrong. That they have their assignments out Doris, sorry, not Deb. Doris said that they have their assignments 6 weeks out in advance. So if you only have 4 people on the schedule, for like a really long time, that there's only going to be 4 people, which is not ideal, right? So, and they chose not to do anything about that. Also, J. Michael, thank you for gifting memberships in the chat. It looks like there's 5 of them. I truly have no idea how that works, but 5 people, go snag them. And that was very, very kind, J. Michael. Thank you. Um, uh, please enjoy all of your internet rambles together. We go on some fun tangents in Discord. And if you know how to acquire gifted memberships, let me know. Because no one's ever done that. So that's really cool. Thanks. So they walked in, there was 4, there should be 12. They basically didn't clock in. They then were told, hey, we're going to escort you off of the presence. They were told they escorted them off the premises. They pulled in other nurses from other areas. And when they went to go back to work, so that's who staffed that night, was other people, as far as I'm aware, was they pulled other people in. They said, we will cover it. Why they sent them home in the first place confuses me, because I'm like, now you have 4 more people. Like, they did find other people to like fill these holes, but like, why wouldn't you keep the original 4 who literally just asked for more help? They weren't saying like, I hate you, I'm not coming to work. They said like, please, we've asked you a million times. Please, you knew this was a problem because only 4 of us are scheduled. Please just give us adequate staffing so we don't accidentally kill people and risk our nursing license, which you will then take us to court for, or someone will take us to court for, because horrible things happened. And they said, no, you can't come back. How dare you speak to us like that? So that's confusing. They went back to work the next day and they were told you cannot be here. And they were suspended, and they are still suspended. So exactly, Chelsea, it makes no sense, right? This just seems vindictive, because if you were really like, it's one thing to be offended and be like, oh, like, how dare you take a stand? But you're literally only shooting yourself in the foot when you don't let other people come in. It's just like honestly ridiculous. Hannah Purr, who was the charge nurse for the day shift in the emergency department on Friday, provided crucial details. She explained that the day was busy and staffing issues have been a chronic problem at Ascension. It sounds like, for a little backstory too, that this hospital, St. Joseph's in Joliet, was acquired by Ascension, which is like a huge healthcare hospital healthcare system in general. And it was acquired and it has then absolutely tanked, right? So it sounded like this was a great place to work for. And then this other company bought it out and now it's not. And that is a very common situation, which you are seeing more and more. There's these huge healthcare systems, Ascension, Advent Health. They go through, they buy up all these other hospitals, and then they just absolutely, I mean, it's a business. So it's all about the bottom line and money. And so that is, from my understanding, when things took a turn a few years ago and they started like super duper cost cutting. And yikes, yeah, not ideal. And so this is what they did. When they reviewed she explained that the day was busy. Yes. When they reviewed the night shift nursing assignment, they realized the night shift only had 4 nurses scheduled. That included the charge nurse and another nurse that had picked up a shift. So that was even including the 4 people includes the charge nurse. And if you don't know, in the perfect world, the charge nurse does not have patients. I have lived on a unit. I've worked on a unit, felt like I lived there. I've worked on a unit where the charge nurse had no additional patients, and the charge nurse is in charge of, they're the extra resource person if you need help. They're the one who's talking to all the other units, coordinating transfers. It's kind of just like the overseer of the day, right? I've also worked on a unit where I was a charge nurse and I had a bunch of patients. And let me tell you, trying to run a unit and help all the people and then taking care of your 4 people or 5 people, it's not good. So that would be including one of these people would be extra distracted because they're also trying to run the whole unit of 51 patients, right? That's not a small number of humans. And so essentially there were only 3 nurses technically, because one of them was the charge nurse who is very busy with other things. That is ridiculous, absolutely unacceptable. There were 51 patients in the emergency room. There were also about 30 in the waiting room. So that's 80 people. And the rest were given a waiting room, and the rest were on the main side of the ER. I felt like we had to do something, so I contacted the Illinois Nurses Association. This is that same charge nurse because this is a very unsafe situation. Yes, foreign nurses are not going to be able to adequately take care of 51 to 80 people. Very dangerous. If you can imagine, we had a critical patient or a code come in. So if someone who's actively dying, I hate to tell you, but it takes more than one nurse to help people who are actively trying to die. Usually in codes or situations, it takes at least four nurses. I worked on where I had codes, we had like 6 nurses in the room. Granted, we didn't have codes like, well, in med surg we had them a lot, but in peds, I mean, we didn't have them all the time. So if you work in the ICU, how many nurses run your codes? Because you would be very good at it because that happens all the time. Or if you work in an ER, how many people run your codes? I bet it's at least 4 nurses, right? So all the staff would be in the emergency, right? If you roll up out of a car accident, it's going to require more than one person to take care of you. So we're seeing that 4 doesn't work very well, right? So she contacted her nursing union, which is what you should do if you work at a union hospital, to say, hey, please help me. I don't know what to do here. And so I talked to the night shift. They came in for the shift and they were willing and ready to work. They waited until the clock in until they were waiting to clock in until management or upper management had secured safe staffing for their patients. So I imagine this charge nurse called management and was like, hi, we're not going to clock in and we're accept responsibility for these people because we don't have enough people to come in. And that is when it gets interesting. Pure added that management simply didn't care about what the nurses had to say or listen to the nurses' grievances because they didn't clock in, security was called and they were quickly removed like criminals or hooligans. The day crew remained beyond the end of their shift until management could scrounge about 7 people, 2 St. Joe's nurses, so 2 people from that hospital, 2 supervisors. Let me tell you, supervisors they're not usually bedside. That's people who are now working in an office, uh, making schedules and doing other things. They aren't the ones you really want taking care of you when you come in having any type of an emergency. One khaki Ascension nurse, probably another nurse in the hospital system, 1 floor nurse, and 1 nurse manager before allowing them to leave. So this is the crew that they got to replace them again, emphasizing that it was just stupid and ridiculous and petty that they made these other 4 nurses who usually work in this environment go home because you're replacing it with someone like me, a floor nurse, who would go down and be like, uh-huh, what? Like, we are not made for the emergency room. There's a reason we do not work there. It is because we like our people to have our predictable illnesses. We know them well. And if it's outside of that scope, I would be like, your foot? Yes, my patients have feet. I was aware of that. But what happened to it? So that's the level you're getting when you bring someone like me, a floor nurse, to the emergency room. I'd be like, yeah, that looks bad. Please tell me your liver is failing, then maybe I can help you. But that I cannot. Manager who is used to managing people, not necessarily helping people. So they'd be like, all of the whiteboards are filled out. We are flawlessly on the whiteboards, all of our names, no idea what to do with any of these things. There's just a lot of beeping. This is very annoying. Make it stop. Someone from the office, and then, a nurse from a different hospital. So that's good. That's a good crew. That's who they replaced it for. This was purposeful intimidation, I believe that, used to warn other nurses that the health system would not tolerate any dissent on the part of the staff. Mead, who attended the rally, admitted that she too had received a warning from management for being there to support the nurses. So they had a rally afterwards. I'll talk about it. But that is just an intimidation move. That's, hey, if you need this job, which most people need their jobs, please speak up and we will promptly get rid of you because that's not going to end well. I don't know if their suspension is paid. I would imagine it's probably not. Usually when you get suspended like that, they're not going to pay you. If someone in the chat knows, please do tell us. But in response to the question of why were there only 4 nurses scheduled? Is there a shortage? Do people not want to work? Do people just not want to work? How many times have we heard that? Do you just not want to work? Very short side tangent. I promise I'll go. It won't be long. This do people just not want to work thing drives me absolutely insane. Like, people in my town were saying it, and there's a restaurant in our town that was like, in a Facebook group was saying like, people just don't want to work. And when you go to look at their job application, because I went into the store to see, they wanted them to be available to work absolutely all the time from 5 a.m. to midnight, no holidays, no weekends off. And for 6 months, you couldn't ask for any time off. And you had to be available all the time. You couldn't have any restriction to your availability. And then the person was in there complaining that no one wanted to work. Oh, and you were making minimum wage. So I was like, oh, that's so. I love when people say that no one wants to work. No, we like nurses would like to work. Most people would like to work. You just want to be treated like a human when you go to work. So, silly ass. So this was purposeful intimidation, saying you speak up too, the same will happen to you. The staffing has been an ongoing issue with the mass exodus of nurses from St. Joe's ever since Ascension took over in 2018. In our discussions, Mead explained that the prior July in in July 2020, a 16-day strike that was held with about 750 nurses at this hospital. The figure has since dropped to like 650, and the hospital has steadily lost nurses. Retention is poor because nurses are treated poorly. You have agency nurses making triple your salary standing next to you. So those are like travel nurses. And why aren't they using that money to take care of nurses? She noted that younger nurses aren't staying because they can get $8 to $10 more at another hospital, and it's terrifying, and you haven't had any training. So imagine that all plays into it. She also reported that the hospital was late in providing the raises that were agreed on in the 2020 contract. So when you work at a union hospital, your hospital and your union negotiate a contract for you, and it lays out what your salary is going to be, what your raises are going to be, what your bonuses are going to be, X, Y, and Z, and it gives you like dates. And there we go. It lays it all out for you. So they have not been holding up their end of the deal. And there have been constant problems with payouts, wages, and bonuses. When the payroll system was hacked last year, the health system shifted to using paper. This led to major discrepancies that on occasion saw nurses' wages garnished for supposed overpay. So that's good. Yeah. So they basically paid them too much in some instances and then said, you have to pay us back. As we learned from Nurse Scott, in California, that's illegal. So we all need to be like California. And if someone messes up and pays you way too much, you just get to keep it. So let's all be California, except for the whole wildfires thing. I grew up in California and we don't need that. We really don't. So that's kind of our situation. Yay. But the biggest issues, even more than like hey, please pay me. Also, have you ever heard of two-factor authentication? How is every other company in the world able to do this except for Ascension, who's like, oh, I guess we'll just have to go to paper. There is definitely nothing else that we can do about this. We're going to have to got to go back to paper, I guess, to pay people. Interesting. Glad you really tried hard to earn your salaries. Good, which we'll talk about their salaries in a moment. But the issue mainly that nurses have is, hey, it doesn't feel safe. There have been more than 160 assignment despite objection forms filed. Just on the patient acuity and staffing shortages. So an ADO form is a document tool used by nurses to object to unsafe, potentially unsafe, or patient care assignments where you don't feel safe. This helps protect you if you were to go to court. So do fill those out. If you go and you end up working a shift but you feel unsafe, fill this out. The assignment despite objection, which basically means you're taking the assignment but you object, because that will give you something to say, I'm doing this and I don't feel safe. So that if something happens, because you can't be with all of those people at one time and you can't be as vigilant about watching what's happening with them, and something horrible happens, you could say, I told you. And you're putting the responsibility back on the hospital, right? Who said, oh no, like we would still prefer to do this. But again, they might just tell you, hey, don't come back. And in that case, please just go find a different job where the people treat you better. Poor said that since the pandemic, there have been cutting of resources, constant downgrading the quality of the products we use to take care of our patients, and the market value that they are now waging the nurses is $10 less than the average in Illinois. So again, not a great look, not a great thing to be like, yeah, let's just pay you less than everyone else. I'm sure it'll be fine. I understand that this is an ongoing issue everywhere in America. There is short staffing. They are busy. I mean, nurses aren't asking for money. They're asking for appropriate pay. We have been demanding this and asking for this of this hospital, and they've continued to refuse to raise wages. Now, this is interesting, right? Because Ascension is like taking over the absolute like world, right? And let us take a brief pause and let's just look and see. Because I was like, I wonder what Ascension as the whole, like what their people make, right? Because they probably don't make a lot of money. So I'm sure they don't make a lot of money. Let's just look at what they make, right? Because I'm sure a good charitable company like this, um, they probably don't make like a ton, right? Because here we have, oh, St. Joseph Joliet, right? This is their website. This is the hospital in discussion. First of all, I just had to be petty and I had to point this out. Our flagship hospital in the Joliet area, Ascension St. Joseph Joliet, delivers specialty care and 24/7 emergency care. I mean, it's not like, you don't have nurses to run it, but it's fine. And, comma, as a new sentence, we have a level 2 trauma center. Like, you couldn't figure out how to put that in one sentence? Like, that's petty, but that's their like first line on their website. That's what shows up on Google is and, comma. Like, I am not good at language, but that's bad. So they pride themselves on their emergency room, which is ironic because, as we'll see, it's not that great. We've got some issues. So these lovely humans are the people that work there. Where are we with here we go. This lovely group of people, Ascension Leadership Team. So Ascension is based out of, I believe, Missouri. And they're the ones, remember, that own everything. And look at this super nice, diverse group of people running this company. Maybe we have one non-white person, mostly dudes. This is good. So this is just very nice. Joseph R. Impekiki or whatever is a lawyer and Masters of Health Administration. Let's go see how much these people all make. Okay, I don't think he was there during this other mishap, but we'll see what his contemporary or the people who had his job a few years ago, what they made, because it's a lot of money. It's a lot of money. And let me see. Where did my money go? Here we go. Okay. So, here we are. How much money did some of these lovely people who own this company or are important in this company make? Well, I'm glad you asked. Joseph, the president, made $7 million. The executive EVP made $16 million. The CFO made $10 million. Anthony, whoever this is, the CEO and chair before he quit, made $10 million. Karen Springer, the EVP, made $3 million. Their former board officer. So we're in the millions here. That's lots of millions. So that's good that they made all this money, yet they're making all of these budget cuts, which is interesting. Just interesting to note. And then we can also go back and look at what their company values are, which I just thought was kind of interesting because I was like, this seems very, you seem like a crappy company, but they're rooted in the loving ministry of Jesus as a healer, which Jesus is honest, right? He's supposed to be like an honest person who likes to just help people and not take advantage of people. I think that was the one that that's what I, having been raised in Christianity, that was the vibe that I got. Aligning our care with our Catholic healthcare ethics practices, which helps to foster disciplined decision-making processes that promote our mission and value of just being good, decent people. We're advocates for compassion and just society through our actions and our words. That's one word for it. With special attention to those who are poor and vulnerable. Our Catholic health ministry is dedicated to spiritually centered holistic care, which sustains and improves the health of individuals and communities, but mostly for me. Mostly for the people who are making the millions of dollars. Interesting. So just interesting. Allow us to go back and see here. So that's kind of the situation that we are currently in, is they are doing the good work of Jesus by making millions and millions of dollars and killing people. So by not staffing their hospitals appropriately, which is an interesting approach, probably not the one that I would take, but it is the one that they have chosen to take. So, okay. So they did hold a protest, right? Nurses in Joliet, Illinois organized protest after 3 ER nurses. This is 3. It's actually 4. It's fine. We all make mistakes. So they'd had this happened. Oh, this is what the hospital said. So John Fitzgerald, a staff representative for the nurses at St. Joe's Hospital, explained that the gathering at the nurses Friday night requested adequate coverage for the shift. So they all got together. Security was called. Fitzgerald added that the hospital had several sentinel events. That's when bad things happen. Sentinel is people dying or bad things, very bad things happening that have led to patient deaths or permanent or temporary harm due to unsafe staffing. So, hey, this is a problem. This is not just nurses being cranky that they have to, not eat or pee or they have to work for a bajillion hours. No, this is actually, this goes beyond that. They would like to, be treated humanely, but on top of that, they really just don't want people to die on their watch. My understanding is that there were at least 2 sentinel events in this hospital that derive from unsafe staffing in the last week. And I bet it's probably more because it's really difficult, really, really difficult I bopped you. Really difficult to say that, this is targeted only to, this is only something that happened because of staffing, right? Because the hospitals, you're sick if you're in the hospital. They're going to be able to be like, oh no, it wasn't that your nurse you didn't die because your nurse had 8 patients. You died because of your kidney failure. Like there was nothing we could do. Right. When in reality, maybe that nurse would have been able to notice much earlier that, oh, you haven't peed in like a day and a half. That's not normal. Right. But you can't notice that because you're just trying to get your meds out to your 8 or your 9 patients. So you don't have time to realize like, hold on, red flags happening. I should address them. And they're going to be able to brush it off. So that is another reason why these things tend to just, they're like, well, we can't definitely say that it was because of that. Correlation doesn't equal a causation, right? And then they throw your favorite research line right back at you, which is like, it just so happens that all the patients that are dying also had horrible nurse to patient ratios, but that doesn't mean anything. Many of them center on the issues of medication error. So a lot of these patients are having med errors, which is then causing them to die. That is a lot harder to pinpoint somewhere else. But again, they're going to now pinpoint it on the nurse instead of the hospital itself. So that's exciting, which is unfortunate reality across the country. Hospitals have sought to pin the blame on nurses, as in the former case of the Vanderbilt nurse Radon Devot. We've covered that case extensively on my channel. If you want to go look at it, that's a nurse who gave the wrong medication that was a paralyzing agent instead of one that calms you down, and the patient died. And that has brought up a whole lot of conversation about safety things that weren't in place. Just a whole lot of things. In attendance to the rally was Timothy Nelson, an Ascension spokesperson, who offered a perfunctory PR statement claiming that St. Joe's was committed to working in partnership with our nurses, while also respecting the terms of our labor contract. In doing so, we are conducting a thorough investigation of recent events. Which basically means we definitely want to work with you nurses, which I have to say, otherwise you will all leave. But you also need to hold up your end of the deal, right? Which is that you'll come to work and your labor contract. But the labor contract also says you have to provide livable working conditions, which aren't really happening. According to their agreement in July 2020, AMITA, now Ascension St. Joseph, would improve staffing guidelines based on certain units and consult with the union on staffing issues by the end of 2020. But that sounds very vague, right? And that's the problem with a lot of these contracts is it's very vague. We will improve staffing guidelines, but what does that even really mean? It makes it very difficult to tell. And they would have better ratios. Nurses were facing patient ratios of lower than 1 nurse to 12 patients. So, that's not good. The 1 to 12 is not good. According to the Illinois Nurses Association, again, that's the union, hospital guidelines required the unit to be staffed with at least 10 nurses, but generally safe staffing ratios in the emergency room are much lower than other areas. On Friday night, only 4. We got that. So yes. So in general, very not good. Basically, the hospital also, and they're recommending at the time we wrote, rather than expanding the struggle for safe staffing levels, spreading by the strike to other sections of the hospital and health. They were appealing to they were trying to say hey, we're going to go to the government and try to get legislature passed. And we will look at the Safe Patient Limit Act published, which has pros and cons. And we will look at that next. I'm going to take a second to look at some comments, and then we'll go into what they're proposing is form of legal action, because apparently everything else doesn't actually matter. So, yes. Santa Ray said, I've been trying to kill the gnat on my screen for 4 minutes and it's Liz's mouse. Perfect. I know someone did say union and we're trying to summon Adrian. She's probably off doing one of her 12 jobs. Management always cares more about whiteboards than people. Yes, they do. In case you are not in the healthcare space, management, you can be in the middle of like coding someone and they'll walk in and they're like, why isn't your name on the whiteboard? Because that's something that like the hospital, what they decide is important versus what nurses think are important. Like nurses, you're just trying to keep the person alive. And the management's like, actually, you need to like identify yourself to the patient. And like one time, I had a nurse manager who came up to me and told me that I had just finished being in a code, right? So I had been on the, I was staying over, like, I don't even remember the situation. I was like in a code with my patient and the night had been insane. And the manager, I just remembered, walked up and was like, why isn't your name on the whiteboard? I'm like, well, if they're dead, like I came in and I had to prioritize like, oh, am I going to try to save your life or am I going to write my name on the whiteboard? And I figured if they were dead, they didn't really care what my name was. And she didn't like that. She didn't really like that at all. Then I worked nights and weekends, never had to see her again. And this Matthew Ives, right? If something happens, you can say you did everything you possibly could do to make things right, but the hospital wasn't interested in helping. And this has to do with that form that you can sign saying basically you were accepting the assignment against your will. So yes, it says you knew this was sketchy and you are, the hospital should take responsibility for it. Doris is our wonderful friend who understands, who has worked here. Management did it in response to what ICU nurses did several nights before. They didn't suspend the nurses. The ratios would have been 1-4. So the ICU nurses had also, I believe, is that what they were holding the rally for? They were having like a rally about the ICU nurses because the ICU nurses came in and they were supposed to have 1 patient or 4 patients for every 1 nurse. And in ICU, it's 1 to 2 patients per nurse because you're like on a million drips and you have a bajillion things that you need to be done and it's just not safe. And the hospital, the people were upset about that. And so it sounds like they were making a statement with these nurses by going after them. So thank you for that context. I really appreciate it. Shandi said, Ascension bought out a lot of hospitals here in Wisconsin and it's a total poop show. That is what I have heard. At what point, Shantis Ray says, at what point does someone investigate and make changes? When the public starts to care. That is why we do this, literally. When patients start to not want to go to those hospitals, when the public starts to realize that this is a public safety problem, this is not a nursing problem, because right now it's still very much the world does not know, right? I know a lot of people, I've said many times, I'm the worst person to go to a barbecue or a party with because I start talking about this stuff and they're like, excuse me, what? Like, they're like, what is happening in the hospital system? I'm like, all these things. They have no idea. And it doesn't, people don't know until they're affected by it, and they won't make change and hold hospitals accountable and demand things, put laws into place that put patient ratios in place if they don't know it's a problem. And until you interact with the hospital system, that's usually when you find out for the first time. So that's why I try to do these videos and I talk endlessly about it on the internet so that we can raise awareness for it, so that these bills can hopefully get passed and that people are just generally aware, so that people choose hospitals that treat their employees decently. Like, why isn't that a metric of here's our nurse patient ratios? I would love to see that on like Google reviews everywhere. It's been like, hey, here's, we're really good at heart surgery, like they always talk about. And also here's our nurse patient ratios. You should feel safe and attended to here, right? That's what I would love to see. So that's why I talk about this on the internet. If you like that, leave the video a like, shameless plug, so that other people can watch it. Happy Dog said, if they were able to get replacements so fast and send them home, why the heck were they not able to get the extra support earlier? That's a great question. That is a great question. And the answer was they just did not care. They did not care to do so earlier because they didn't have to. They're used to people showing up and just dealing with it. And this is when nurses said, no, I'm not dealing with this anymore. This is not safe. And then the hospital was like, you're the problem, not me, which is ridiculous. Joe Campbell, you don't even need to go through a traveling nurse agency anymore. At least here in the Northeast, many hospitals are offering internal travel contract for comparable pay by that agencies offer. So going to other hospitals, if like in that system. It's ridiculous. J. Michael said, third largest system in the U.S., Ascension, St. Louis, 139 hospitals. So how well? And I think when hospital systems become huge like this and they are not, and they are a for profit, right? They're nonprofit, but like nonprofits make a ton of money. Uh, that's when things start getting icky because it starts to become like a monopoly, right? Like where else are you going to go? They are in this for the money. It's a not a great look. Suzanne works for Ascension in Michigan. They only care about profits. The RNs are expendable, as we are seeing, and they're only going to be able to work through so many people, right? Before they start getting a reputation, and people will not go there. They will not go there no matter what. And people are going to start to, this is going to get ugly, right? Before it gets better. Because in order for the public to really see what's going on, I like to say that I'm going to go on the internet and rant about it until it changes. But the reality of the situation is healthcare will not change until so many people are dying and everyone has been affected by it. And everyone knows someone who went to the hospital and it was horrific, right? Because that's when people get passionate about it. I know other people in my life who I meet at these parties and they overhear me talking about it. They're like, oh my gosh, my sister was just in the hospital and this horrible thing happened to her and there was no nurses and it was just a mess. And then they get passionate about it, and people aren't going to get passionate about it and wanting to change it until they're affected by it, which stinks. Doris said they fired their CNO this week. Good. Because obviously they weren't doing anything anyway. Suzanne said the administrators make changes without ever asking anyone who actually works on the floor for input. Ding, ding. It just has gotten worse and the patients suffer for it. Yep. Pamela Robbins, the Nursing Staffing Improvement Act of 2021. If hospitals do not implement direct care nurse committees recommendation on staffing, the hospital is fined and goes, then they go to scholarships. That fixes, the hospital is fined and fines go to scholarships. That fixes absolutely nothing. Yes. So this is a huge issue with, some of the stuff that they do. And they also are not very specific about it. We'll go and look at it, but exactly. A lot of the punishments that are put out in legislation. So when we say like go vote for nurse patient ratios, they'll put things like this in and it's like, oh, well, if the hospital doesn't comply with the rules, then they are going to we're going to fine you, and the hospital is never going to take that fine out of something that's going to go towards, their CEO's salaries. They're going to take it towards like, oh, well, now we don't have to give certain patients who qualify like certain care, or we won't give it out to our residents who maybe we could expand our program to, or things like that. Santoray said, I've been thinking about this over the past few weeks. Would it not be more effective to advocate for a safe nurse to patient ratio through law instead of fighting organizations? Yes, absolutely. That is absolutely the way to go, is to go to the big part of the problem is ultimately it would be to go to Centers for Medicaid Services, right? And say like, hey, this is not safe. You need to demand it, because if Centers for Medicaid Services did it, things would change, but that's a state thing. So that would be something everyone going to their state for Centers for Medicare and Medicaid Services and saying, you need to make this a rule, because they're the ones who have all the money, right? They're the ones who pay the hospital. So that is ultimately who we need to get on our side. And the second best thing is that we need to put laws into place that actually protect this, because yes, some contracts with union hospitals, some union contracts, like when I worked at a union hospital, our contract that was negotiated with the hospital spelled out nursing ratios. Most do not. This hospital's did not. It said it should be safe and agreed upon. It should be generally agreed that this is like when it's this acuity, when the patients are this sick, you should have this many nurses. But we don't do that. And it has to be directly spelled out. Otherwise, people are going to take advantage of it. So yes, ultimately, the goal would to be somehow influence Centers for Medicaid Services, which I don't even know how you do that. Like, do you lobby to them? Do you prove to them like people are dying? Again, you have to get the public to care. And then second best is to pass laws like California did, where it said, hey, on a med-surg unit, you can have this many, 4 or 5 nurses to 1 patient, patients to 1 nurse. You know what I mean? And that's, yeah. Doris Carroll, at my hospital, they refuse to allow staffing committees to review Sentinel events because it's confidential. That's ridiculous. So basically what this is saying, and this is our insider information from this hospital, or from the Illinois Nursing Association, the union, at their hospital, they refuse to allow the staffing committee. So the staffing committee is the one who, I'm assuming, says, hey, if patients are this sick, they should have this many nurses, because that's what the union said. They said, hey, you need to come together with the hospital. We're not going to tell you exactly how many nurses need to be with how many patients, but like we will have this committee oversee it and they will help you decide. But it sounds like that committee can't see when bad things happen because it's deemed confidential. So they don't get to see, oh, wow, the nurse that had 9 patients and one of them died from something that was totally preventable. They don't get to see that to help influence their decision, right? Which is what you would want. You would want to be able to take that to the committee and be like, look, when I had this many patients, I couldn't take care of them. And this person died because of it. They don't get to see that information. So they're making decisions blind then, but they're like, oh, we're still upholding our contract. Like we're still upholding our end of the deal. We're still doing it. That's fine. That's infuriating. Corey Jackson, teacher student ratios are publicly available. Agree with Liz that this should be for the same for nurses. Patients would choose which hospital their floor nurses has 4 versus 8 every time. Exactly. That's a great way of looking at it. You can see how many students are going to be in your child's classroom. I can look that up. I know where the girls are going to go to elementary school. We were looking at that the other day. We were like, oh, hey, this is, about how many kids are in this classroom. And then you can petition to see if you want to go somewhere else. That's when people start going like school shopping. That's a whole other thing. But that's what I would love to see is, hey, what are the ratios here? It would also be nice if they posted how many people they, that would never happen, how many people they killed from having, unsafe staffing. But Doris says, we review the units, FTE, it's Illinois law. Pam Robbins said on this call was instrumental in crafting the staffing committee legislation. Units, FTE, full-time employment. They review the units, how many people work there full-time. On this call was instrumental in crafting the staffing. Oh, we have someone else, Pamela Robbins. Perfect. Here she is. People will always try to run over laws. Doesn't stop regulating safety. Hospitals have unilateral power. Regulation levels that field. Yeah, just gives power back to people. Also, thank you, both of you. Well, everyone here. Thanks for being in the chat and being super active in it. I'm going to go back and read everything everyone said later. I can't while I'm on the live because my eyeballs will fall out of my head and I can't focus. But I can see a bajillion chats going by and I like going and reading them later. But Pam and Doris, this is super helpful having you because you're like in it. And yeah, so it does having some kind of level, something that's bigger than the hospitals, right? To legislate them. And usually they do that by holding back money, right? Because that's all hospitals really care about. Unless they're this hospital that cares apparently about people, especially poor people, which is why they make $10 million, Make it make sense. But that's who they care about the most. That's exactly who they care about the most. Okay. So Doris said during the strike at UIC, the comment I said to the press dog kennels, during our strike at UIC, the comment I said to the press was dog kennels have ratios. Why not hospitals? Doris, don't you know we treat our animals better than our humans? Come on now. We require all sorts of things. If you want to even adopt an animal, there's all sorts of, they have to have like, your house has to have like a fence and a yard and all of these other things for the dog. But we don't really care if our humans live in such conditions. When my husband and I were trying, when we were much younger, we were looking into getting a dog and they were like looking at my apartment because that's what we were using. We're like, oh, we'll try to, my apartment's nicer than his house. So we'll try to get like the dog through my apartment, but we didn't have all these things. And so we're like, oh, well, you can't like live there, but it's fine for me to live there. We also are much more compassionate to our animals at their end of life. That's why we're nicer to our animals. Silly. Thinking we would treat our animals as people as nice as we do our pets. Yeah. Oh yeah, for sure. Yep. We treat our animals better at the end of life in particular. I could not agree more. Also, yes, I second this. Bravo, Doris. You the bomb. I love that you said that. So let me go and let's look really quick at, we'll look at this comment really quick while I try to find it. Joe Campbell said on an average night, our emergency department staff to patient ratio is 6 patients to 1 nurse. I'm getting that mixed up like crazy tonight. I apologize. Many nights the ICU is so full, you can have a couple of ICU patient holds on top of an already busy assignment. So that's like the ICU doesn't have beds, so you have your ICU patients. Usually the ER is supposed to be stabilize and send out. That is the goal. You either send them out to the hospital, you send them up to the floors of the hospital, or you stabilize and you send them home if they're healthy enough. So it is a very different type of care to then continue the care after you have stabilized, which is also like not something ERs usually do. So that just puts further stress on ER nurses who are used to the stabilizing and send. That's why there's different units, because that's a specialty, right? If you tried to send a ICU nurse down to stabilize an emergency room, they would probably be like, this is very disorganized and no, thank you. And they're used to keeping people, critically ill people, stable, right? So it's hard when we go into other places, and that's not ideal. So further leading to problems, problems and problems. Let us look at, what were we going to look at? Oh, this law. So a lot of the places are like, oh, let's go past this law that's in Illinois. And I'll show you it. I mean, it's like, it's what we have. It's not ideal, to be honest. But it is what there is. So it's not passed or anything. So it's still something that if you live in Illinois, you could write to your people about. It's the Nurse Staffing by Patient Acuity Act. This is still sitting in committees. It's not going to be even looked at further until 2023. So please, if you live in Illinois, maybe just look at this. I have it linked down below already, and you can see, let people know what you think and where they could improve it again. And if you, we just all need to go work in the government because it's just interesting who writes these laws. And then you're like, I don't really know if you've ever, well, you have clearly never worked in healthcare, because this is like, basically it goes through and they're trying to make a model of the law that's kind of like California's, that says, hey, if you have this type of sick person, it should have, you should have this many nurses in relation to it. But it doesn't define it. Whereas California's defines it. It gives it a number, says, hey, like we said, ICUs, 2 patients to 1 nurse max. This says it's an acuity model, which means they basically have people come in, and they have a committee, like Doris was saying, that assesses the complexity of patient care needs, requiring professional nursing care and skills and aligned with patient care needs and nursing skills, consistent with nursing standards. So this is a lot of like fluff language to say, let's have a committee look at it and they get to decide. But as Doris was saying earlier too, if you don't let the committee see what is actually happening with patients, they can't make an informed decision. So immediately that's a problem. The nursing committee would have to be like hospital wide. So everyone would, is this not the right one? Which one is this? We can look at a different one. This might not even be the right one. But this one is something that exists out there. Oh, that's the one from 2008 that's already in effect. Oh, never mind. Good. So this one's, let's point out what's kind of useless with it. So this is what we have already. Okay, good. I'm glad this is the one that doesn't work, because I was reading it and I was like, this does not work. Let me show you why. Okay, so they're trying to make a new one, apparently. My Googling skills, friends. Like I said, my brain low. But this actually works out well, because I didn't like it. Here's why we don't like it. So this is what they have effect right now. And it, first of all, it says that which makes sense about the committees. If you can't see a committee, how are you supposed to know? How are you supposed to know, right? If you can't actually look at the information, what are you doing? It also only pertains to registered nurse, I thought, which was weird, which means a person licensed as a registered nurse under the Nurse Practice Act. So I guess they don't see LPNs as nurses. So that's always, we just know we're off to a great start. If they're like, this only applies to registered nurses, even if LPNs, work there, we're like, oh, well, so we just forget about those nurses? Okay, that's fine. Every hospital shall implement a hospital-wide staffing plan prepared by a nursing care committee or committees that provides for a minimum direct care professional registered nurse to patient ratios. So they say every unit needs to have one of these, including inpatient nursing departments. If the staffing plan prepared by the nursing care committee is not adopted by the hospital, or if substantial changes are made to it, the chief nursing officer needs to provide an explanation. Wow, that's harsh punishment. Or with the reason that the plan was not adopted, or provide a written explanation of any substantial changes made to propose a new one. The written hospital-wide staffing plan shall include, but not be limited to, the following considerations, blah, blah, blah. The only thing that really looked important was in order to provide staffing flexibility to meet patient needs, every hospital shall identify an acuity model. So every hospital needs to have one. They apparently, there's a new one. You can see why this doesn't work. The staffing plan will be posted. It needs to be in an obvious spot. If it doesn't have it in, if they don't do it, then they just cut like your money, and then we just lose money for we just lose money for all the scholarships and stuff. No hospital may discipline, charge, or take any adverse employee action against an employee solely because the employee expresses a concern or complaint regarding the alleged violation of this section. So that might probably help these nurses because they're kind of having adverse employment situations because they spoke up against the safe situation here, because I'm pretty sure the committee probably didn't say that this was safe staffing, but what do I know? And any employee of a hospital may file a complaint with the department regarding an alleged violation of this section. The department must forward notification, blah, blah, blah. They have to tell them within 10 days if you're in a garbage situation, essentially. So that is where we are. We'll see if Second Opinion can find our other article. If not, that's where we are. But there is one that's going to hopefully be coming. I think I saw it that they were going to have one about ratios. If I find it, I will leave it linked down below. It's basically probably the same thing that we see in lots of other states. Where they really try to be a little bit more specific, because clearly this situation was not helpful. Super nerd, I think we need to see if most nurses suck or do most hospitals suck. I feel like some nurses probably suck because there's a subset of the population that's just the worst. And we can't change that. But usually most people don't go into nursing because they're like the worst. They go into nursing and then the hospitals totally screw them over and don't give them the tools or the supplies they need to actually do their job. And then it makes you really burnt out and exhausted and not care. Because if you keep going to work and you don't have what you need and you're putting your life and the license you worked really hard at on the line, you're going to not care. So yeah. So I would argue that. I don't get why they would fire nurses when there's already a huge staff problem. It's to make a point out of it because they want to scare other people and have them be like, oh crap, like I really need my job. Right? How many of us could actually get fired and be like, well, I'm just like, we say, oh, just go take a different job. What that really means is like, stay at your, you know what I mean? Like if you can, and realistically, a lot of people can't just quit their job and go to another one. Should you start looking? Absolutely. If you work at a hospital like this, absolutely. Please go start looking at other hospitals. And until you can get to a safer hospital, just fill out those adverse assignment forms, right? Saying like, hey, please look at this, right? And this is not, to help get some of the liability off of you. If Adrienne watches this, I'm sure she'll have all sorts of comments about other things to keep you safe, but that would be my recommendation. D-Spirit says we need independent observers at each hospital. The hospitals can't self-regulate themselves. It goes against their nature. Exactly. They're always going to protect themselves. They have all of the money. And yeah, a national strike. I feel like that's eventually kind of what, like I was saying earlier, it's just going to get to the situation where everyone knows someone who's been affected. And a lot of people are going to die before it changes, which sounds very dramatic, but it's also true because this won't change until we really change the laws about it. Until we change the laws about it, until CMS decides to get involved. J. Michael says, what is the unsafe assignment form you speak of? Where was that mentioned? I will link it down below. It is what they used. I don't know if it's nationally used or if it was just used here. It was called the adverse. Oh, here. There are more assignment despite objection forms. Let's see if we can find it. Assignment despite objection forms, ADOs. You can get it. It is, if you are like, it might be, this is from the National Nurses United. So I don't know if it's just if you are at a hospital that is along with this association, but we can pull it up. but your hospital probably has something that is sort of similar. I would imagine we had a form that we could fill out from our nursing union. Um, if we did not feel our assignment was safe, and it basically reported it to it. But here's what it looks like. The purpose of this form is to notify hospital supervision that you have been given an assignment which you believe is potentially unsafe for patients or staff. This form will document the situation. The union may use it to address the problem. So, or use an incident report. Hi, Scott. Like Scott said, if you do not have this at your hospital, you can use an incident report and report a potential or a near miss event. An objection form. Yep. So whatever your hospital has, mine has something very, very similar to here that you see here. And you go in and it says, before accepting the assignment and completing this form, you must give your supervisor or manager, not the charge nurse, notice of your objection to the assignment in writing. So that's pretty standard protocol. We did that too. So you would do this before you do it. Please put your complete name and your title and the title of the person who made the assignment and who you reported the situation to, right? If you do not get a response, note this and submit a copy of the completed form to the next level administration as well. So basically just cover your butt, make a ton of copies and date and sign it. In accordance with my obligations as a registered professional nurse, a patient advocate, I am objecting to my work assignment on unit blank for the blank shift as a charge nurse, a staff nurse, a float nurse, a team leader, or other. I have notified management, insert their name here, that my professional, your name, nursing judgment, I am unable to assure the delivery of safe or adequate nursing care, date, and time. And then you can go through and you can say why, that you were not trained for it. There is not enough staff for the acuity. The unit is staffed with unqualified personnel or inappropriate personnel. New patients are transferred or admitted to the unit without adequate staff. Assignment posted a serious threat or harm, all of these different things. Census at the beginning of the shift, census at the end. What's the unit capacity? How many admins of it? How many discharges were there? Did you have people on ventilators? Did you have frequent vital signs? Yes, J. Rowe said, take the time to fill out and submit ADOs. It is so important. Yes. And let me put this in the description really quick of the video so that people, if they wanted, let me see if we can edit this in real time. Nope, don't do that. Here we go. We'll put it under resources, ADO form. There we go. All right, it should be there now. So if you wanted to download it, again, just see what your hospital actually uses. Pamela Robbins says, ADOs are a tool of the union, unsafe conditions cited by the nurse at the time of shift. ADOs can be brought into a court of law as a notice to an employer of unsafe conditions for them to fix the issue. Yep. ADO says, Mr. Midwife said ADOs will not hold up in court. I would at least fill it out though. Wouldn't you fill it out though and just see like, hey, like this doesn't absolve you of any issues, but if you have to work, like if you are someone who is in a situation where you like can't not go into work and you're worried, like you're in a situation at this hospital, right? Where you're like, if I don't take the assignment because I'm worried about my nursing license, and then they're going to lay me off, like suspend me and I don't get paid, then how am I going to pay my rent? You could at least fill this out in an unsafe environment and send it in, right? I think like at least, right, Matthew, like it can't hurt. Is it perfect? Heck no. And do I think you should immediately look for different job? Oh, yes. Should you also fill out an incident report? Oh, yes. Because we know when you're in court, they're going to look at all these things and they're going to say, what did you do? Because your defense is that, right, as a nurse, let's say something horrible happens. What did you do to try to fight this? Exactly. It might help in a case with a jury. And that might be looked more favorably upon, at least if you go in and you try to say, hey, I did everything in my power, X, Y, and Z, right? At least that's what I think. So who knows? Who knows if that's correct? It won't, Nurse Scott says it won't cover your mistakes in court, but they can gather all the forms up when union negotiations start and nurses demand safer staffing. So yes, it's also a good documentation tool. It won't get you out of a lawsuit. Like I said, I think it just can help your case. Having filled them out before and having had them help, they didn't absolve a coworker situation, but it did add a lot of context and it ended a lot more favorably. It came back on the hospital and not them. Because they were able to say, I did not want this assignment. It was not safe. Still their fault. And it can't hurt. But they also were able to use it to do other things, like Scott said, with the hospital to gather all the forms. And then you have a paper trail, right? If, like Dora said, if it's not documented, didn't happen, is it a huge pain? Is it a huge pain to have to fill this out? Yes. But the people, if there's not a paper trail, we can complain all we want, right? But if there are not documents like this, if there are not incident reports, if there are not things that get up to upper level management, right? Then nothing will ever change, because you have literally nothing to say other than, hey, this isn't safe. This isn't safe. When we know they're just going to blame on bad events on other things, right? Because they can't pin it down to something. And having something like this, it's really hard to get out of that. It's harder to get out of that if you're like, well, you're saying that, but like you have 160 different complaints sitting here, right here, right? So a mess. And that is basically where we are with this. I will link when I get it, the other let me see, Doris said it actually will be reintroduced in 2023. We're collaborating with unions, other OGs to make a good fight again. Oh, perfect. So Doris is legitimately trying to save Illinois nursing, and we appreciate you. She's doing the thing that to try to make it better, right? Adchem said documentation has saved me from legal action subsequent to an event during an unsafe staffing. So there you go. Document. And yes, once I find it, I will leave it here. And maybe we could do a whole thing on it if we need to. But there is a new thing in Illinois. Go and support it. Write to your Illinois. If you live in Illinois, I will leave the name of the new bill or whatever it is in the description, and just write to them and explain why you need it. Again, the best way to do this, I was going to provide templates. I feel like I say this every time. I was going to provide templates of how to write a letter to your legislator, but having talked to my own legislator, they said that, because I said, what would be the best way to get other people to listen? And I said, should I make templates? I was literally explaining my YouTube channel. The person he probably thought I was crazy. He was like, no, actually, he's like, if it's all the same thing, you don't even read it, because it's just the same story over and over and over again. It's much more effective if people share their own experiences or experiences of loved ones, or like, hey, here's the situation. Even if you're not personally affected, just explaining the situation in your own words, you know what I mean, makes it much more personal. So if you live in Illinois, please write to them, explain these situations of what is happening and why it's so important. Sentinel events are happening, that nurses are trying to go, they're getting late, like suspended from their jobs because they went and do work and they were supposed to have 4 patients and they had 13, and that's not safe and people are dying. That is the things we can write and say, therefore, I think we should support this bill, or I think we shouldn't, or we should enact this, or we should include this in it, right? And give them the why behind it. Shanta Ray said, Nurse Liz, what's your opinion on why nurses cannot come together despite being placed in unsafe positions? I don't know. Okay. I think nursing has a long history of being very, okay, this is probably going to make people mad. It's fine. I think nursing has always historically, been the underdogs, right? Of there's the physicians and then there's the nurses, right? And nurses have always felt like they have to prove something. This is just my theory. Who knows if this is right? Nurses have always felt like they have to prove something, right? Because they have always been in the theoretical hierarchy, even if it's not real, nurses are not less than physicians, very different skill sets, right? But medically speaking, a lot of people see nurses as under physicians, right? And people, in order to try to better get out of this situation where you feel like the lesser than group, right? I feel like nursing has tried to make itself more legitimate by being very we're going to have all these weird degrees and all these fluffy titles, and we're going to try to be more academic than you. We're going to have all the theory. We're going to have all of this other weird stuff, and we're going to be vicious, and but nursing doesn't have a common, one common unifier, right? And everyone is so cutthroat that instead of like in medicine, everyone kind of lines up, right? Have you noticed that? Like they all get behind the AMA, and they all kind of just toe the line. They sort of fight for things in general together. But I feel like nurses, because it was so, it's just like everyone is fighting to try to be their own. It's much more individualized because it's the group that has always been trying to prove themselves. And since you don't have the power as that underdog group, I think it's just people are going to go about it their different ways. There is a lot of weird methodology in nurses where there is a very odd, very disturbing, people think they're way better than other people in nursing. And I really think that just comes from everyone trying to like, I don't even know, like get ahead. And they think like heaven forbid, um, like there's no, I'm going to extend my hand to you and pull you up with me. Nursing seems to just be much more like, um, cutthroat. Like, I'm not going to help you. I got mine. I'm going to keep going. You know what I mean? That's my opinion. And I think it's just, yikes. But I hope, Cassie, I agree. I hope it's going to change soon. I hope nursing can kind of like get their act together. And at the same time, as that is all happening, I think we also have an issue where nurses are also predominantly one, we're like predominantly female, but even more than predominantly female, like, and like, um, I think in general, women are less likely to uh demand things, right? Like his like, which is, you know, I'm not trying to be whatever, but I think men are much better at asking for exactly what they want. You know, my husband goes into interviews, he's like, this is exactly what I want, this is exactly what I expect. And I don't want to hurt people's feelings. I'm like, well, I don't want to like ask for something and then have them think I don't deserve it, which isn't an all women thing or an all men thing. I think that just tends to be sometimes what happens. So the fact that everyone's catty and cutthroat because we're less than, and also at the same time, like nurses are generally very like, you go into it because you want to help people, right? Usually. Um, you want to make money too, but you want to help people and you don't want to offend people. You're people. And so we go in and we don't stand up for ourselves. We get stepped on. We get you know, it's kind of the same as like giving professions, teachers, therapists, where you go in and people will, if you don't, if people ask things of you and you just keep giving and giving and giving and giving and giving, they never have to do anything, right? They're going to keep asking for things, right? And I think that's kind of the roundabout way of saying that's where I think we are, is historically nurses have given a lot. We've said, that's fine, I won't pee for 12 hours. That's fine, I won't eat. That's fine, I won't do this. That's fine, I won't do this. And we love people generally. And then we get to a point like this where it's broken. We say, I cannot do anymore. I cannot bend anymore. I cannot give anymore. You need to give, I need standards. But for so long, those haven't been in place. And then the whole infrastructure is fractured because everyone's just out for themselves. It's a mess. It's an absolute mess. I don't know. That's what I think. Let me know what you think in the chat of why it is the way it is. But it is our good nature, Chelsea, I agree, is constantly being taken advantage of. We're not taught in school how to advocate for ourselves. We're not taught the business side of things, of ask for these things in interviews. Here's how to conduct different interviews. Here's how to do all of these things. George R.B., putting up boundaries is hard. Exactly. And we're not taught how to do that. Literally in nursing school, they start prepping you for like, hey, you got into this, like, this is the job. Your patients are going to hit you. Here's how you're going to deal with it. Right. Like, they literally start prepping you in school about hospitals are going to take advantage of you, which is in like every other career, right? They do the opposite. They're like, hey, hey, friend, like, here's how you don't get manipulated. But we're told from the very beginning of our careers that we're going to get stepped on and that this is just how it is. And it's a whole mess. It's a whole mess. Hey, Sophia, how are you doing? So yes, that is what They hand out the lube in the last semester of school. Chelsea, it's true. They're like, here you go. Get ready. Put your big girl panties on. Yeah, exactly. Exactly. So that's what I think. The moody priest disagrees. Let me know what you guys think. If yeah, there's 370 people here, which is a lot. So thanks for being here, friends. If you are enjoying these things and thinks other people need to know about it, do like it. That really does help the YouTube gods send it to other people. And it makes me happy, all things. And but ultimately it hopefully gets the message to other people before they have to have loved ones who die. Because that's kind of our alternative for when we're going to see change. And it's not good. Doris says, nurses have no voice unless they're in a union. I rose up through the ranks in my union and worked full-time, divorced with my kids in the last 10 years of my 37-year career. I had no fear because I learned to organize, educate, and agitate. Yes, I love that. Organize, educate, and agitate. I love that. I like that. And that I think we need more people to do this. I do think unions are going to be a huge way to do that, right? Because you need something that can fight against the hospitals. And since these hospitals are becoming enormous systems, you need an enormous system of people like nurses to fight against them. So that's where we are. Agitate. Yes. Oh, all I can think of is my washer when I hear agitate, but I like it more in terms of this. I feel like that is agitate. That would be a good agitated would be a good descriptor of me. The agitated nurse. That angry one over there. Nurses must use their power. Yes. I think we are just now realizing that we might have some. For a long time, I think nurses didn't really realize we had some. And I think the more people realize that we can stand up to things like this, the more that we're going to see change. The code of silence is what we have had for a long time. I agree, Jen. Nursing is a calling. The code of silence is just, we're not going to talk about it. We'll protect the hospital. That, we're going to deal with it. You go and you work there and you sign all the things saying, I will not talk about this on social media. I will not share anything like this. I will not talk about this. And I think people are now becoming less and less likely to be like, no, I'm not just going to be quiet. Right. Because we're getting mad, which I love secretly, because I too, like Doris, could be called a troublemaker. And love it. Love it. Nursing is, Charlotte's right. Nursing is terribly bureaucratized, circular discussions of all, few courageous decisions made. Yeah. Nurses just love to throw out big words. And well, look at my title. We have stupid titles and we're so focused on stupid things. We aren't looking at things that could actually implement change because we want to fight about which type of nurse is better. Well, you can't practice here because you only took these classes and you have these letters after your name and you do this and this and this. And we spend all of our time fighting about that and about what's my title going to be and what are you going to be called? And well, I don't think ADMs should be allowed to do this. And here's my biased research, garbage research on this, right? We spend all of our time on that versus actually looking at hey, what is something that could affect all of us versus infighting? So if we could stop fighting with each other, friends, if we could stop fighting with each other, then I think things would be great. So fight against the big thing, not against each other. Doris and Pamela. Well, Pamela, I'm very, thank you and Doris for being here. I like friends who are not quiet and who make a lot of noise. So thanks. I've decided I'm your friend. Good luck. Good luck. And if you really ever need anything, let me know because, I want to make these things. This is what I want to do. It's just get other people to realize things, explain things, hopefully, and just raise the word about things. So if you ever need anything, let me know. Not that I have the power, but 309 people might watch it and they might get to hear the message. J. Rose said the old nursing school mentality is slowly changing. I'm seeing it work in my last 20 years as a nurse. We need to step it up though and make noise. Yeah. I think the people who are graduating now, especially, they're like, no, I will not take that. Like when I got hired, I was kind of like, ugh, I was kind of like, all those things are kind of scary and not ideal, but it's totally fine. I will just deal with it. And now I feel like people are like, no, I will pee. Thank you. I will pee and I will eat. And you will pay me a lot better. You know what I mean? So I think people are coming around to it. We're talking about it more. For all the yucky things that social media is. I think social media we're shifting away from nursing, I hope, is this glamorous, like, this glamorous thing where like you show it as like, oh, nurses are actually running the hospital. And aren't we all like the hottest stuff in our cute little bathroom selfies? Like nursing is so like posh and cute. And I think we're talking more about like what it really is and like, hey, and we can do the thing and we can change things. And we don't need to be these meek little cute bathroom creatures who do other people's bidding. So, nursing, Church of POS said nursing is one of the few fields where education letters are listed on name tags, BSN, MSN. The public doesn't care and it finds a way to divide us. 1,000% agree. Nurse is what it needs to say, but it's a signal to the people among us. You know what I mean? It's a signal to the people among us so that you can further divide people. Cassie, we miss you too, Doris. You get to know Doris in person. That's amazing. Yes. So there, nursing is not cute. Agreed. We just passed the lovely Halloween holiday where it's like, why is nursing a Halloween costume? Because no, nothing I do at work. Everything I do at work is Halloween appropriate, but not for the reasons you think at all. Okay. All right, friends. Well, I've got to go to bed. Because vacation, it wasn't really vacation as I am learning. Apparently it's called, all my friends told me it was called a trip. So we were gone for like 8 days and my friends were texting me and they were like, hey, how's your trip going? Like, how's it going? And I was like, this is like our first vacation that we've taken in absolutely years, maybe like 7. I don't even know. It's been a long time where we were gone for like a year. No, maybe. I don't think Joe and I have gone on one other 1 week long vacation and it was our honeymoon. So that was 10 years ago. And I was like, this is different. I was like, this is a lot of work with small children. I wouldn't really call it relaxing. They're like, oh, no. Once you have children, vacation is not vacation. It's called a trip. It is a trip away from home. And things are never the same, but we went with my parents. It was really, really fun. We had a lot of fun moments. It was just a lot. Disney with small children is no vacation. Yeah. We went to Disney just for the one day and we had 3 adults for my 2 children. And once again, J. Michael, you are a trooper. You survived all of my children's feelings. I tried to warn them ahead of time. And we met in the morning. I'm like, so you're humans. How are they temperamentally? And he was like calm. I'm like, oh God. Like, well, mine are not. We went on, yes, he did get to be, they came around, they were like buddies. He was buddies with Avery. But we would get all the way through a line. We would get to the very front and then they would both melt down. And they were like, I'm not going on it. And we're like, okay, let's go to the next one. Teacups. We'd get all the way up there, melt down. I'm not going on that. All the way to like Autopia or whatever it's called now. I'm not going on it. I think it took an hour and a half, to finally get on a ride. So if you have a 3-year-old, save your money. Don't go to Disney yet, or find a friend who very kindly gets you into the parks for free. And then just know that you're going to take like an hour in the beginning to just adjust and just do the one day. Cause they really did. They came around and I would say the last 6 hours were really fun. They had a lot of fun, but just do the one day. Friends, just the one day at Disney until they're a lot older. And then you can go and you can ride the Skyliner for free. We did that. We rode the monorail many times. We went to the resorts and pretended we were staying there. Just follow people through the gates. As long as you look touristy enough, you can go to the Polynesian and go on the beach. You can go and get Dole Whip. You can go and pretend you're fancy and go to these other resorts. There's a lot you can do for free at Disney. Please do that with small children. It's much less painful on the soul. much, much less painful. So yes, I agree. Someone said we had a really good conversation tonight, and I totally agree. I appreciate all of you being here and having the conversations with me. I really do think that slowly we're going to be able to change things, a wee bit. We got it. We can do it. And yes, I appreciate you guys are the ones that make all the things super like fun, and like it's way better when I'm not talking to myself. So thank you for being here. If you do want to like the video on your way out, I appreciate it. The YouTube gods appreciate it. It sends it to all the people. Um, what is Liz hopeful? It's probably the Sudafed. Probably the Sudafed at this point. I'm glad they give you hope. I hate it when there's like a bunch of nursing students in here and they're like, "Oh, I hate everything now." I'm like, "Oh God, I'm so sorry." Um, but yes, do that. If you want to be in with the Discord server, you can always join the channel. If you want to get random emails about other thoughts, I have a mailing list that's down below. I'm trying to think of all the things I'm supposed to talk about to be a good YouTuber. I think that's it. It's going to be an exciting week for the next 2 weeks. So everyone hold on. We have an NP binder coming up next week. My she runs my life. She's texting me. So be on the look for that. If you get that. And yeah, hold on to your horses for the next 2 weeks. My sister is going on vacation and I'm alone trying to run this channel, which if you don't know, she does a lot of the running of it, and I just kind of show up and talk about my topics, and then she makes all the magic behind the scenes happen. So everyone cross your fingers for us. It's going to be a wild ride. The wildest ride in the wilderness. You can't go on adult rides if you have children too. Disneyland for me is my magic place. Children kind of ruin that, if we're being honest. But it was still fun. It was still fun and magical, but just alter your expectations. Hold on to your butts. That's right, Chelsea. Hold on to your butts. And yes. So also thanks, Scott, for hosting our last week's Friday discussion. We're doing our Midwest goodbye now, where we say goodbye and then we remember another topic and then we eventually say goodbye. So thank you, Scott, for hosting last week. If you want to go see his video, you can go to his channel, Nurse Scott, a YouTube channel. And he talked all about they did a whole live on things about like craziest nursing stories, right? And so you can go check that out. It was great. He also talks about his hospital experience, which was enlightening. Always good. You should go watch that video because it's like doing great things on the algorithm, which really helps his channel. So funny stories. Thank you. Funny stories. So do go watch that because if you catch videos when they're on the algorithm swoop up, it super helps channels. And that's a great channel to help. Mr. Midwives is a great channel to help. OB Nurse Chelsea will have a channel. It'll be up. We will be doing a live stream on Friday on my channel of an unknown topic that I will hopefully email out more than 10 minutes before, because again, I will be without my sister. I did see one thing on Texas Safe Harbor. I think we've done videos on that. Safe Harbor only works in Texas and maybe one other state. That's basically saying if you don't feel safe, you can apply for that in your nursing assignment. But yeah. And Rogue won the day. I was watching that video, this funny nursing stories, on like the airplane on the way back, and I was just like giggling, and people definitely thought like I was giggling and my children were crying, and it was an interesting combination. So anyway, they were like, that seems rude of you to just be giggling while your children are like kind of losing their minds. Like, it's fine. And yes, so there we are. But did you die? No, we all made it. Slightly possessed. I tend to listen to a lot of YouTube and podcast things that make me laugh at really inappropriate times. And then I have the earbud and I pull my hair over my ears. So then I'm just sitting there and I kind of don't laugh until I like really laugh. Like, it takes a lot to make me laugh out loud. And then all of a sudden I just will like snort. So I'll just be sitting there and I'm like really loud. Oh, it's really good. It's really good look. In person, I'm very awkward and just it's a good time on the internet as well, but more so on person. Uh, yes, before the plane took off. um, I did not wish you that. My sister said, "Did they die?" But in true me fashion, she's like, "Hey, let's hope the plane doesn't go down because then you're the only one left." That is not what I said. I said, "If the plane crashes, enjoy your inheritance and my debt." I don't think my debt transfers to you. I wished you an enjoyment of your inheritance. I didn't say that I hope it doesn't go down. I said, if the plane does go down, enjoy your inheritance. Geez, you don't have to split it with me if that helps. Oh, all right, friends. Thanks for being here. I so appreciate you. Um, please do know that you are more than enough. You deserve to get good nursing contracts and to feel safe at work. Okay. You are not alone. You are not the only one feeling like this. Together, we can do insane things. And you, my friends, we can do hard things. I will see you later in the week. Have a beautiful one. Au revoir. I don't even speak French, but look, I can say goodbye in it. I can say goodbye in German, tschüss, or auf Wiedersehen, and then Spanish, adios. I don't know whether any other language is how to say goodbye. Bye bye. Can say it in toddler. Goodbye. That's it. That's all I've got. All right, friends. Bye.